Welcome back to the Takeout. The CBS News exclusive Face the Nation moderator and chief foreign affairs correspondent Margaret Brennan spoke with former CDC chief medical doctor, Dr. Debra Houry, who resigned in protest after HHS Secretary Robert F. Kennedy Jr. fired then-CDC Director Susan Monarez, who'd been on the job for just a couple of weeks. Quite happily for me, Margaret Brennan joins me now. Margaret, what do you know?
Well, Major, before we sat down with the doctor, we read through 250 pages of her emails that she had provided to the Senate Health Committee as evidence to back up her testimony to Congress. She described chaos within the agency, political interference, and conflicts of interest.
Documented in these email exchanges.
Documented in these emails, which she wants to now be public, and they are. You can read them online. She was the CDC's top medical official, worked at the agency 10 years or more. She had been an ER doctor, and she expected that she would be asked to brief the secretary, for example, on the ongoing measles outbreak.
Okay.
His office never would allow for that to happen. Another thing she pointed out to us, his office refused not just that offer, but to they didn't want to read the evidence of her requests to help give him correct talking points. She would hear him...
On measles.
On measles. She had heard him go on television and say things that were patently false, factually off. And this was at a time they were trying to encourage the public to take the vaccine to stop the outbreak. She said, can I please go help him with his talking points? Can I brief him? That was never taken up. And by the way, the record was never corrected publicly in terms of his false claims. She talked through a number of incidents like this in our extended interview. I want to play for you a clip of what she believes is one of the risks to public health. Take a listen.
Please.
Now it's April, and the country's experienced its worst measles outbreak since 2000. You're receiving a lot of messages asking for information about measles from Kennedy aides, but it was backward looking. It wasn't about the ongoing outbreak. And you wrote, active measles response has to take priority. Why did you feel you had to say that to the people running the health agency?
One would think you wouldn't need to, but, you know, as we were trying to support Texas and other states, we had limited staff, as, you know, staff had been fired under DOGE, trying to respond to an active measles outbreak, and also trying to support the secretary using appropriate talking points. You know, he would say things like there's fetal parts in vaccines, and I sent an email to correct that and said, how can we help him? You know, how can we make sure it's the right messaging? During all of that, we also get, you know, requests for 15 years of data on every single measles case, and were there any, you know, other diseases that those people had that died from measles. Same time, a former group of the secretaries put out a statement saying that some of the measles deaths weren't due to measles. So to me, it seemed like they were looking through CDC data, these requests, you know, to answer some questions from other organizations or potentially promote their beliefs. Again, not based on science or reality, but trying to answer an agenda that was already in place.
Which organizations?
It was the Children's Health Defense.
That's where RFK worked. That was his...
Yes, he was a leader of that organization.
And sued some of the vaccine makers, as I recall. In the email exchange, it stood out that you seem to be using very diplomatic language, very careful language, but you're offering to help the secretary. You said, can I help him with his talking points? Why were you so concerned?
It impacts lives. You know, when you look at him talking about misinformation on measles vaccines, people are going to be less likely to get the measles vaccine in an active outbreak. We had children being hospitalized. We had children dying from measles. We needed people to respond during a measles outbreak and get vaccinated if they weren't. Instead, he talked about healers and treatments around like steroids and antibiotics and even vitamin A. We actually saw vitamin A toxicity cases in hospitals. People were taking too much vitamin A because there had been messaging that it was helpful for measles.
Once you have it, not as preventative.
Correct. Once you have it, and then limited amounts, and, you know, with a doctor's oversight.
So you hear from her and the other 3 senior officials who resigned alongside her the frustration that science doesn't change based on who is in office. And so for these medical professionals, they were frustrated that people who weren't doctors, who didn't have medical degrees, were the ones advising the secretary rather than the physicians themselves. So the emails that we are talking about there are part of a trove that Senator Bernie Sanders' office has made public. You can read them online. And the doctor told us she hopes now that there will be careful investigation into the CDC and all the federal agencies where there are concerns about scientific integrity. And the secretary did say at one point later down the road clearly that he would encourage people to take the measles vaccine. But it is the misinformation, the confusion, and also what she alleged in here, the linkage to the Children's Health Defense. That is a strong suggestion there that there was a conflict of interest on his part trying to prove a theory that would then allow for suing of vaccine makers. I reached out to HHS for comment on that. They have not responded to me.
Margaret Brennan, great stuff as always. Thank you very, very much.